Namaskar. Welcome to this 222nd episode of Gyan Pravah. When we started with one, we never thought it would get this long. And it's all the brainchild, the motivation, and constant encouragement of our president, Dr. Sunita Tandulwadkar, madam. As we all know, she is the head of the department Gynae, Chief IVF and Endoscopy Center at Ruby Hall Clinic, Pune. She is also the founder and medical director of Solo Clinic IVF and co-founder and medical director of
Asha, no need of my introduction, beta. It is your day with Dr. Jana.
Ma'am, I would just like to say one thing, that you, after being in practice for more than 30 years, are all the time innovating, thinking of something new, something great. And today our topic is next gen women's health, which will bridge research and practice. Because Dr. Jena is from Pharmet, he is a doctor and he is working on the research arm and also looking after the digital marketing, the regulations. So I think we will have a lot to learn from him. So over to you, ma'am.
Thank you so much. Thank you, Asha. You are one of my most dependable chairperson, and always I feel proud of you because when you start any activity, you see to it that you pursue that activity. For example, getting the news bulletin every month. When you started that, I felt in 2-3 months this will die off because it's difficult to come out news bulletins, so many topics every month with so many authors together. But I'm checking it because you are asking for the presidential message. You are showing the news bulletin, which is so educational. Every month after the month, and 8 months you completed, I realize Asha is the name, which is absolutely the perseverance, taking everything what you start, ending it is equally important. Today you are having a Dr. Jana with so much difference. I rate your CV, sir, and it's our proud moment to have you. And I'm sure the dialogue between both of you will be so educative and so important for everyone out there, whether they are a gynecologist or from any other field. It will be inspiring to each and every one. Dr. Jana, 222, today the number of our episode, and it's so fantastic. I'm feeling so proud of all my chairpersons. And though I was thinking it is for the chairperson, I'm designing this project because I have a 30 chairperson, so 30 days are given to them. But believe me, sir, I'm meeting the personalities like you every night, 8 p.m. I'm learning, I'm listening to you all from the viewers link. And it's definitely evolved me more than my chairperson as a person, as an individual. It helps you to understand life is larger than what you look with just your two eyes. So thank you for being here on a Foxy platform. I joined just to welcome you all, to make you feel that Foxy honors your time, your value, and is always grateful for being with in our broadcast. Thank you.
Thank you, ma'am. Thank you so much. Thank you for having me here. And I am feeling very much privileged and proud to be able to come to this platform. And the feelings that you are having is very, very much reciprocal. I am thinking that this should be a very, very much needed program, because it is not, we all are into the different pillars of the same system.
Yes.
And sometimes the link is not seen, but it is always there. And it is actually the job of us to establish that link. And I think such programs can really enrich us both, not only from the knowledge perspective, also from the perspective of the real world, okay, which works on some different rules out of the textbooks. So I am very happy, ma'am. Thank you very much.
And Asha, thanks goes to you for showing us the link. Probably, as sir said, the link is always there. Unseen link. Today, you are establishing it. And thanks to you for having such a beautiful, fantastic faculty. Thank you. And I wish you enjoy your podcast and sing. Thank you.
Thank you, ma'am.
Thanks,
Thank you,
ma'am.
ma'am.
Thanks.
And thank you for sparing time in between patients. Thank you so
No,
much.
no, don't worry. It's my pleasure. Thank you.
Thank you, ma'am. So, Dr. Jenna, that was
Yes,
a
ma'am.
beautiful welcome that we have received, and I've received a lot of encouragement. So, we take the program forward.
Yes, ma'am.
I read in your CV, actually, you remember I met you at AICOG 2025 at your
Yes, ma'am.
stall in Mumbai.
Yeah,
And I was looking for a good person who is knowledgeable and who is willing to share that knowledge with us gynecologists.
certainly, ma'am.
And I got your name, and you are the Senior Executive Vice President looking after medical and regulatory affairs, business alliance, and digital marketing,
Yeah,
all at Pharmed Limited. I also came to know that Pharmed is more than 50 years old.
yeah,
It's a Indian company. It's been in the market through all the ups and downs for the last 50 years. So I want to ask you, as basically an opening statement, that you've worked across this medical, regulatory, business, and digital fronts.
yeah.
You know, can you share how these different roles that are encompassed in your work activity actually intersect for today's healthcare?
Actually,
Because,
ma'am.
for us, they would require four different people, but you
Yeah,
are four in one. So,
yeah. Actually, ma'am, to be very frank, these appear to be separate activities. But actually, if you see healthcare and the patient at the center, which is the main job of the doctor and also the pharmaceutical industry, these four are very, very much interrelated. Those are no longer the separate silos where you store some data or information, and they are interdependent pillars of today's healthcare system. For example, the medical affairs ensures the science remains the credible and clinically relevant driving force for both the doctors and the pharmaceutical company. Regulatory affairs safeguards the compliance and the patient safety. Business strategy and alliance makes innovation sustainable, manageable, replicable, and it ensures access and affordability of the patients who are the end users. And today's era where internet is connecting us, okay, distance has become almost a non-existent phenomenon. Okay, digital innovations are happening on a day-to-day basis, both in the technological front, in the practice, and also in the research forums in the pharmaceutical industry. So that extends our reach through many things, such as telemedicine, patient education, real-world data, digital CMEs, webinars, which can enrich not only the doctors, also us professionals who are in the background supporting the industry, and also the patients who are craving for information in today's era. So in that way, I see that these four different activities are not separate. These are only one, only to establish and continue the momentum of our era, where healthcare should be an affordable phenomenon for the patients who suffer and who deserve innovations and new opportunities to get cured quickly.
So, sir, from your perspective, from a pharma perspective, what are the biggest challenges that face women's health in India? And
Oh,
your industry and us clinicians, how can we collaborate to address these challenges? So, it's a two-part question. One is, what are the challenges? And then, how can we collaborate to, get over those challenges?
yeah, ma'am. So I would like to say that there are basically 6 areas of my challenges. It is nothing textual. What I am saying is purely from my experiences and readings. So therefore, you may be finding that some of the points are not exactly relevant to the practice as on today. But I believe that those are very, very important things. Even now, although we call the specialty gynecology and obstetrics, I believe that maternal and reproductive health has persistent issues in India, in our country. Still, the maternal mortality needs to improve. Anemia corrections are very, very important health issues which the government is battling with. And there are pregnancy complications. And the more we go along, more our detection capabilities are increasing, more complications are being detected. So these are the three important medical issues. Then rising non-communicable diseases in the women. So when I say gynecology and obstetrics, I say that the women has a place to go in terms of their healthcare, that is gynecologist and orthopedician. For example, the other day, one of my gynecologic friends was telling that the women come to us and asks me about hair fall. So that is a place to go. So non-communicable diseases are often ignored in our women, and gynecologists and obstetricians can really take the important role of at least identification and channelization of these patients.
No, but how can industry help, sir? That is my question.
I'm coming there, sir. So I'm just talking about the challenges. So I'll be taking just a minute. Nutritional deficiencies is wide. The menstrual and gynecological health has not yet reached its pinnacle. Mental health in the women, it still needs intervention, and there is a big rural-urban divide. Now, if you ask me that how the industry can help here, industry can help you on number one from innovation point of view, finding out the unaddressed issues. But most of the cases, there is a problem that industry in our country takes a decision on their own. They think that the commercial ways of analyzing the market and the opportunities is all. There is a need for involvement of experienced gynecologists and obstetricians to enter into this area, identify these issues, and work with the pharma industry at tandem, to find out the solution. That's number one. Second is the nutritional deficiency is easy to correct. However, cost-effective solutions are not available or not attainable. So the very reason that the whole best doctors are located in the elite metro areas shows that this is very difficult to achieve. But pharma can find out a cost-effective and economic solutions. Mental health is often ignored because they think that it is a matter of the psychiatrist. But mental health has implication for the other diseases which the patients may suffer from. So therefore, the pharma can come up, with programs of research, number one. Second is development of the products which are needed. Third is permeation of information through the digital channels. And fourth is supporting the activities which can make these programs patient friendly. So in that way, actually, pharma can come and partner with organization. In that way, whatever I have researched, Fogsi has already started these things, but Fogsi can be a very important partner in organizations with the pharmaceutical companies.
Sir, I would like to say, Madam has one project which she is running pan-India, which is called Sampurna. And what it is telling is, you have talked about nutritional deficiencies. She is basically checking obesity and anemia in the general population. So, because her target that she wants us to propagate is that every pregnancy should be a wanted pregnancy in a healthy girl.
True.
So the woman should be healthy and the pregnancy should be wanted. So that is her Sampurna project. And it deals with a lot of these factors that you are saying. Now, I think we need to take the program forward. We come to the regulations. We need to be fast, otherwise we won't be done.
I'll be able to.
Regulatory approvals are, everybody thinks it's a lot of red tape. They are difficult. But have there been any changes in that it has become faster? That makes, that we need to know.
The new drug and clinical trial rules have recently been amended. So earlier it was taking in 90 days, but in the name of 90 days, it was taking months, months and months. However, government has very proactively implemented few rules. Now the new drugs and clinical trial rules are mandatory that they will have to give an approval or reject it within 45 days time. So a full approval timeline has been nearly halved. The products which are already existing in foreign countries where there are regulatory stringency, we know that the pharmaceutical research per se in India is very, very poor. Okay. Here also I would like to say the obstetricians,
Well, sir,
clinicians,
here I would like to differ with you.
yeah.
You people need to support us better.
No, I'm coming there.
Involve us in the research, and
Yeah.
then we are definite. There are 45,000 gynecologists in Foxy.
No,
If you could get involved, everybody sends you one report. You
Yeah.
would have 45,000, which is better than any international paper.
Yes.
So what I'm saying is that, you need to be proactive. If you remember, I spoke to you about it when
Yeah.
we met there. But it's been 8 months and nothing came of it.
Yeah, true.
So
Because
the thing is, I am totally against blaming India for anything. We need to make it better. We need
No.
to make it better. We find what are the lacunae and we work towards that. So that
Okay.
is what we are discussing here today. Government has made it better. They are giving it in 45 days. Now, the next part of it is that this regulation, does it affect the availability of newer drugs, devices, or things, or medical equipment?
No. Actually, when there is an existing regulation approval in any other country, actually there is a fast track process which is already in force, which can allow the approval quickly. That means going to market would not be taking more time.
Okay.
The
So
May
a vaccine that is available there will become available here.
Yeah. But there is a need for a quality control, which is not a big hurdle, in my opinion, in terms of the time or the approval processes. So the red tape is not a reality, okay, any longer.
Another thing, sir, that can you share a few examples where this regulatory thing has actually worked for patient benefit, either to facilitate a drug or device or to stop a drug or device?
Yeah, I can tell you, there are several examples. Okay, for example, there is a very simplified export and licensing process now available, and biologicals and the vaccines have been aligned with the global standards. So naturally, if we follow those guidelines, getting those products into India is no longer problematic. If you take the COVID as an example, COVID vaccination, the India originated COVID vaccination was available, and that actually saved India from the turmoil time, and also saved a lot of money because the other options which were available internationally were very highly priced. Okay, that's one. And the recent this HPV vaccination, okay, for cervical cancer, okay, India originated cervical cancer vaccine is also an example, okay, where the regulatory processes had actually helped to go it faster. Government has also started from the CDSCO, okay, any products, okay, which are not following any regulatory norms in the true sense of the term, they are rejecting those products, okay, out front, okay, without any bias or any other preferences. Okay. Ma'am, I can't hear you, ma'am.
So I would like to ask you that it means that the products that are available in our country are following a certain standard.
Yes, that is a must, and every company is doing that, aligning that.
Okay. So now, we come to the next section, and that is what are the trends in the industry and clinician partnership, which can actually enhance women's healthcare delivery?
Okay, that's a very important issue, point of contention. However, okay, I mean, I am not indicating, but I'll have to speak my mind. Otherwise, my flow of thoughts will be gone.
Yes, sir.
ma'am, historically, this is a very important period. Historically, drug-related investigations, okay, has not been centered in universities or medical colleges. That means
Agreed.
drug discovery process has not happened. Okay, what we have always dependent on is that, okay, our philosophical approach that the others will be discovering the products and we will be taking the benefit of it. Our industry is actually based on that. The structure and the functions of the industry is not dependent or structured around innovation. Innovation means there will be chances of
But
failure.
I spoke to you and you were innovating so much.
Mm.
Your company is innovating a lot.
Yeah, we are innovating a lot. We are
Yeah.
innovating a lot, and based
And
on
you
that,
are Indian.
yeah, no, the problem is, ma'am, starting from the table of the innovation to see the light of the market, okay, is a huge, horrendous system because the hierarchy of the industry is older hierarchy. Okay, they do not believe in investing money into these things, and therefore what they go for is a very simple thing. What is available, sell it in the market. Why do you bother to?
Me
Okay,
Too products.
yes, that is the problem. So I actually had a struggle to show it. Look, having a me too actually gives you a disadvantage. Whereas if you have something innovative, bringing something new which can really help the patients and is of value, then you don't have any difference in the business achievements. So what I propose is that from today onwards, let us think in this way. Okay, it is not only what I innovate. I am an oncologist by education. Therefore, my innovation will be having certain lacuna. Whereas you come into the platform and and you start advising me, okay, my on the table research, okay, will be far more accurate. To my idea, we actually generate lots of fantastic gynecologists and obstetricians. However, okay, our this part of the brain in our country is totally oriented towards practice. Okay, again, I am not blaming anybody.
Agree.
Therefore,
I agree with you.
therefore, therefore, it is not only the practice. If you are a practitioner, you are also a professor, you are also a teacher. Your job is also to be involved in research and also to collaborate with the people who can bring that research into a fruitful form of a product. Because business always is dependent on the product. That's number one. My second point is the screening. Okay, the screening and the preventive methodologies which can be utilized very simply even in the rural areas can be a fantastic tool which can be jointly developed. HPV vaccination, okay, collaboration with the pharma industry can be actually a very good collaboration. Okay, if gynecologists come up with the proposal and companies give their budget for corporate social responsibility into it, that can be a fantastic thing. Okay, safer contraceptive devices, then regulatory backed diagnostics such as gestational diabetes mellitus, then streamlining the clinical trial regulations for women's health drugs. This can all be collaborated. Okay, I can give you some example of the clinical partnership. There was a 2024 Gynovation, which is a digital women's health conclave organized by Bharat Serums and Vaccines. Okay, that actually led to a lot of new ideas. Shikonomy focus and femtech integration, which is happening, and they are coming up with lots of new technologies. Public, private, and telehealth collaboration. Okay, many doctors can be used to do telehealth programs in the rural areas with the help of the structure and the system established by the pharma industry.
Sir,
Then
one
local
more
man.
thing, sir.
Yeah,
One more
yeah,
thing. I'm interrupting you here. You
yeah,
know, whenever doctors collaborate with pharma companies,
yeah.
there is always that risk of over commercialization,
Hmm,
writing unnecessary products.
hmm,
So, and sometimes this doesn't actually happen,
yeah,
but that allegation is there. So,
yeah.
how to actually protect doctors from this allegation?
Very simple, very nice question. Okay, right now, okay, I am having a advisory panel of doctors of gynecology. I'm located in Bangalore. Okay, so we are a 49th ranked company. Therefore, although we are very sharp in innovation, we have not yet been able to gather so much of money to invest. Okay, however, one thing, okay, we include in the agreement that this agreement of the advisory is purely on the advisory. This has nothing to do with product promotion or product prescription. So this particular point is included in that particular agreement. You understand? So both the pharma industry and the doctor should be, because the moment the doctor starts writing, he thinks that I am giving enough. Why should I need to think more? Okay. Because we are practice oriented people. Okay. And the pharma thinks, okay, even if she is not giving me any new ideas, new collaboration, let her go on prescribing. You understand? Anyway, I am spending money, I am getting back money. So it is a simple trading that happens. So this trading is a bilateral responsibility, and they are both the pharma company should be taking steps. Okay. And if there is a forum or a system of collaboration, these points should be applied and instigated as a regulation that you cannot do such things. Okay. Now, there are personal touch in everything. All events will be happening between persons, although it is between company or a doctor, but it is also a personal interpretation of the things. For example, you as a doctor, I won't be having courage to say, ma'am, you just give me some prescription. Okay. I as a doctor, somebody may be saying, I will give you so much of money, therefore you do it. That is one thing. Second is, the digital communication can play a very important role, because perception and actual happenings are two different things. Okay, people actually create perception. Okay, so this perception sometimes is also politically created, right? So therefore, this is our responsibility to wash up that perception. Okay, so over commercialization can definitely be prevented, and in our practice, in our work, I have made it possible that with professional people, okay, who are honest, if they can be taken, and my questions, my queries, and what I want from them is clear, okay, this can be definitely prevented.
Okay. Sir, one more thing, we as Indians, we are a 140 crore population. We are always thinking of what can, benefit the masses. We are thinking of contraception and screening, but we also have rare diseases, and because of our population, those rare diseases are not so rare.
I agree.
So, do you think that there is something which can be a collaboration between doctors and the industry to actually take care of these rare disorders? Because of our population, nothing is rare.
Yeah, you are true. You are absolutely true. So I say that, okay, there are at least 3-4 areas, okay, where this collaboration is possible. Say, for example, preventive oncology. Preventive oncology, the problem becomes that the diagnosis. Most of the cases, the diagnosis as of now is invasive diagnosis. Okay.
No, sir, a lot is being done for prevention.
Yeah, that is what I'm saying.
Yeah.
So that particular area is one of the evolving area, I would say, and there definitely big collaboration is possible. Preventive strategies. Okay, there are many preventive strategies in the treatment that can prevent the cancer. So one is diagnosis, another is strategies for prevention, then maternal risk prediction. Okay, that I think there is a lot that has happened. Okay, but maternal risk prediction in the remote areas, particularly, okay, there must be easy ways to find that out, and investigation or research must carry on there, and
actually,
there can be very
Fogsi
good
has
partnerships.
developed a gestosis score for hypertension.
Yeah.
And even for anemia. So a lot of things are going on. But what about rare diseases? Because for these general problems which are creating a lot of maternal mortality and causing a lot of cancer mortality in women, but the rare diseases that I'm talking about, is something happening on that front?
In India, nothing is happening, but in the world, there is a lot happening.
So then we have more cases. So that is
Yeah.
one avenue that you people can look after.
Yeah.
And
So,
after this session is over, I'm going to ask you how I can collaborate and how more people like me can collaborate.
yeah, true.
I will
True.
definitely be asking you because this is what we had spoken in January and it still hasn't worked out.
Okay, so there are actually 6 different areas where
Wait, sir. That is a later question. That is a later question. Okay, so we now proceed. You have spoken so much about digital health,
yeah,
digital platforms, patients' expectations. These days, you have that class of patients who come after having read everything on Google with
yeah,
a big muddle in their heads.
true.
So, what role do you think we have for this digital outreach? We
Super.
as gynecologists, for patient education, do you think we have a role? Because
Definitely.
for the
Yeah,
patient, an influencer is more influential than a gynecologist.
yeah, true. Totally agree. So gynecologists have the responsibility to establish in her or his patients that the real source of information is the doctor, number one. Second is, uh, even now in India, many patients believe that the doctor actually is the right. They do not take anything without the prescription of a doctor. Yeah, today in the younger population, there is a craze of following a social influencer or become a social influencer without any background roots. However, okay, the doctors will have to identify reliable source of digital health information, number one, and they will have to routinely share this information with their patient. It is one of the jobs. Then telemedicine must be integrated into the practice. And this telemedicine must be, okay, must be having digital elements, okay, which the patients may access and read it. At least the follow-ups can be virtual. Then digital patient engagement and educational tools. Preventive or, for example, PCOS, there is a lot of education that matters. That is a common important thing that can be developed in collaboration with pharma also. Then there must be community. Like social influencer, fake social influencer have a community. The doctors and patients must also create a community. Okay, this community not for discussing anything. Okay, it's a digital community through which the awareness campaigns happen. Then data pharma can contribute to digital research and data generation. Okay, and there is definitely an ethical and professional responsibility. Okay, we cannot go against the craze of the social media, but what we can do is strongly and silently we can build our strong areas of communication system. That is what I mean.
So doctors should be digitally aware.
Definitely.
They should be digitally aware. And, in HPV vaccination or cervical cancer screening or contraception, do you think any digital intervention has had a positive effect?
Yeah, definitely. There had been several campaigns. Okay, that has happened actually. Today, today I got a message from one of my senior doctors in gynecology that she is organizing 8-9 different camps. Okay, so when I attended her program, I came to know that what she has done is she has targeted the schools and school children, okay, who are eligible for the age, and then they arranged parents meeting whereby the parents came and gave this consent, and then they are having a regular, within a week's time they are having about 7 camps with 2,500 patients. So this is supposed to be happening in the month of September. So there are other such things. Okay, Bangladesh is nearby. Okay, Bangladesh actually made a very big move on a digital forum. 38% of their eligible female population finished, okay, the HPV vaccination within a period of about 1 month or so, as far as I remember.
Sir, I think COVID for us is a big example.
Yes,
With that
true.
COVID platform,
Yeah,
which was following up everyone and
yeah,
getting the certificates, the first dose, second dose,
yeah.
booster. So COVID for us was such a big success on this.
Nobody in the world can do a co-win. That is what I want to say. It was like so satisfying. There
So
was a name, there was a name error, and I didn't have to go to any office. I had to just raise a complaint, and it was rectified. That is what I'm trying to say.
so digital has worked for COVID, and
Yeah,
if we have the will, if the government also has the will, then this cervical cancer vaccination can also take off in the same way.
definitely, definitely. I totally believe in that. And there had been a HPV vaccination adoption in India. There was a digital training for the doctors. 11,000 ob-gynes are virtually trained by Fogsi. In your organization, they have done it. Dharwad, there is a Rotary Club. They deployed a structured digital enabled awareness campaign. Okay, so the things are going on, but the doctors will have to be digitally literate. They will have to deploy digital system. It is no longer only the skills of the hands, okay, or the care of a gynecologist. It is now also additional requirement that you will have to be digitally enabled.
So another thing is that, whenever some research is happening,
Yeah,
by the time it reaches the patient, a
yeah,
lot of time has elapsed.
yeah.
Sometimes you've lost the patient and then the research comes in.
Hmm.
So, is there anything that the pharma and clinician together can do to accelerate this process?
Yeah, I have already told that it is not that pharma is separate. Pharma is an essential part of the practice. Okay.
So you have researched something.
Yeah.
How can I help to validate it and
You
get
will
it to the patient?
no before that. What I want to say is that rather than me completing the research, the early clinician involvement in the research is a very important part. The
Okay.
clinicians will have to be brought in from different sectors, and they should be coming in to suggest on the research of the protocol. That will remove 90% of the barrier. Okay. And solution would be coming a very quicker rate. I want the involvement at the protocol, research protocol development stage. Then it is not only, okay, a product is launched by a research and that is the final word. After that, there is an implementation. There must be a real world evidence partnership that what exactly happening, the registries, electronic health records, observational trials. Okay, what is your experience? Okay, from the point of view of clinicians, that can be very important matter to pursue. Okay, as a real world research. Then CME has not and knowledge translation. Knowledge I have and you have, that is not enough. Okay, because that is not tangible from the business point of view also. So CMEs and knowledge translation will have to happen at a faster rate, and that can happen only through the partnership. And we can also jointly work to simplify the regulatory and clinical interfaces, whereby a practitioner, okay, says that, look, if you can do this, it becomes a far more simpler and a regulatory compliant phenomenon. Then health economic analysis and research, that what we are getting in, that become very pricey, people can't afford that particular solution. And we have a HEOR studies. Okay, these studies can actually say whether it is economically palpable or utilizable solution or not. Okay, those studies can be partnered, and digital health can be a great connector. Therefore, what I want to say is that pharma can give the evidence, tools, and the platforms, and clinicians will be guiding the priorities and the implementation. So if we can achieve this, okay, although our current pharma system business does not work in that way, but I believe that the intention is coming up, and one day it will be definitely coming up, and it will evolve into a very close partnership without, I mean, for the sole interest of patients, okay, patient remaining at the center can happen in a very effective manner.
So, sir, is there any specific research in gynecology where you see, major breakthroughs and where we can help?
Yeah, AI, artificial intelligence, okay, is changing the scenario, okay, very slowly, particularly in terms of preterm labor, fertility outcomes, urogynecological condition. Platforms have not yet been created, but it is happening somewhere. Then liquid biopsy, non-invasive biopsy, non-invasive diagnostic innovations, that is also, okay, progressing at a very faster pace, particularly gynecologic cancer and endometriosis diagnosis. Then there is something called organoid. Organoid means, okay, from the stem cells, okay, they develop, okay, an artificial organ. Stem cells are human stem cells. And on that organ systems, three-dimensional organoid models are created, and they enable new investigations without utilizing a patient. That actually also, okay, makes a ethical clearance faster, which is not possible in a pregnant woman or something. So new drug development, reproductive immunology, disease pathogenesis, and single cell technologies, which are cutting edge techniques like single cell RNA sequencing, these and flow cytometry. These are important techniques which are upcoming and will be utilized on a regular basis in coming 5 to 7 years time.
But sir, where do we come in? Where do we come in?
Acha, you will be coming, okay, in the number one, these systems are, if they are being developed outside, they will be imported. Even India is now a situation, it will be imported to India. Okay. So if pharma, okay, can go into these systems, they outsource it, they make an alliance with the innovator, and then this is brought into it, and governments can be pulled in into this to understand the importance of these things, and actually the savings of money in terms of revenue savings, loss due to diseases, man-hour loss, etc. Okay, then this can be a fantastic triple partnership. That is what I am saying. But I think that in practical sense of the term, we are yet to go there. But these are the areas which are happening. Ovarian aging and longevity is another area of the research.
Madam works on that, ovarian aging.
Yeah. So that is
Ovarian
also going on.
rejuvenation is what
Yeah.
Sunita ma'am works for.
Yeah. Then non-invasive prenatal testing, that is also an important area. And assisted fertility outcomes, simple intervention. So these are the areas which are upcoming. And I think,
sir, these days, personalized medicine is a big name.
yeah,
Somebody's getting cancer, somebody's getting an autoimmune disease.
yeah,
Even such a thing as arthritis, they are talking about personalized medicine.
yeah,
Pharmacogenomics, biomarkers. So,
yeah.
what do you see the effect of that on gynec practice?
This will change the practice, okay, because
How soon do you think they are going to come into the market?
they are
And
already,
become affordable, because getting those markers done itself, getting the genetic studies done, they're very, very expensive.
yes.
So when do you think it will come within reach that you can do the markers, you can have personalized medicine?
It will be about a 10 years time from now.
Only 10 years?
Yes.
So
It
then
will not,
that's good. That's good.
only 10 years, because the personalized oncology and biomarkers are already happening in India. Okay. However, this is available for the rich. Then pelvic floor and urogyne innovation. This has already started in certain hospitals. In MAMS hospital, actually I didn't tell that time, MAMS hospital, my son is doing urology. Okay. So there are so advanced systems that the patients are getting the pelvic floor biofeedback devices, Then Pesari 3D printing is happening based on this thing. So these have started already in India. However, to be having these things in a larger scale, to be able to reach several people, I think that this part is a little bit disappointing, because I feel that the rural-urban divide in India will be perennial, because people thought in some other way and things are happening some other way. But still then, okay, even the rural people are now accessing digital system. They are having teleconsultation. Many doctors have started, okay, visiting from the top city centers or the capital centers to the areas where they can come and access this thing. So things are changing. Okay, it will definitely happening. However, the research must be decentralized. The government must take, okay, lead in this, because there are lots of benefits in this from the government's point of view. Okay, and another point in this area is the privacy. Okay, so the femtech technologies and the privacy is yet to be established. Okay, so that needs doctors who are computer enabled also. There are many doctors who have got degrees, but they are not yet computer enabled. Okay, so those systems will have to be there in the education system also, although the younger generations have a better access and better expertise into that.
So, sir, whenever doctors are dealing with the pharma industry,
Yeah.
what are the safeguards that we should build, the regulators and the doctors, to have patient trust? Because they should not always think that if they are dealing together, to in log kuch gadbad kar rahe, that should not happen.
This patient trust, okay, should be built up. There is only one way. See, if you tell the patient that you trust me, they will distrust you more. So this will have to be built up over a period of time. Even in this area of distrust, there are some doctors who are trusted by the patients, okay, totally to the core. Here, the digital marketing will have to play a very important role, and government will have to execute, okay, the rules of the UCPMP without a tendency of political sensitization. What they do is they sensationalize the thing. This doctor has done this. So doctor is as if he is the enemy of the people. No, it is not. Okay, if one doctor has done that, does not make all other doctors to be corrupt. Okay, most of the doctors are non-corrupt. That is what is the scenario. Because if all the doctors would have been corrupt, these patients would not be having any place to go. That's the first thing. So therefore, I am not saying that the situation is out of hand, but following the ethical codes is very, very important. And you will have to also in your prescription behavior keep the science at the center. Okay, that if there is a evidence and evidence-based platform is supporting it, and if you are doing your peer-reviewed data and India-specific outcomes at the center, not just listening to and blindly believing the pharmaceutical company representative, that is an important parameter to do. Then
one thing I would like to add, sir, these days in medical colleges, there is a prescription audit.
Yeah.
Whether the prescription is correctly written. And the students are basically taught what should be the component of that prescription.
Yeah.
I think even Fogsi runs a course on prescription writing.
Yes, true.
So basically we need to focus on that the prescription has to be evidence-based, scientific, ethical.
It must be. Keep science at the center. That is what is the point.
I think keep the patient at the center.
Yes. I mean, what I am saying is that keeping the patient at the center, all of your behavior as a doctor should be keeping science at the center. It must be evidence-based. Ethical codes is given by like today, the new ethical code from 3rd September, UCPMP is starting. Okay. And it has just modified it to a level where it can be executed. Transparent boundaries must be there between the clinical decision making and commercial influence. That look, I will not be doing this. That should be the message from the beginning. That
so
will
one more thing, for young gynecologists.
Yeah.
how do they, what is your advice as a
Uh,
person who is from our side, sitting on
yeah,
the other side?
yeah. I will
What
understand the
advice would you give young gynecologists on how to engage with the industry
yes.
without compromising their professional independence?
I had always been proposing that government should channelize, okay, legalize, okay, a scholarship platform for the young gynecologists. Okay. See, there is a doctor who by habit, okay, takes money from the pharmaceutical company versus a doctor who is trying to struggle and get up in life. Okay. He needs money and there is a gross disparity between their pays and their work hours. This I believe as a doctor, fellow doctor. So naturally, I am totally sympathetic to it. However, this should not be a start of a corrupt system. As a result, what I had been proposing my company, and also I would suggest the government to also think about that, that they should actually uniform their pay. They are not greedy as yet.
No, sir, I'm not saying that.
Yeah,
Supposing I am dealing with Farmet.
yeah,
I'm dealing with Farmet. I've done this program with
yeah,
you.
yeah.
Now, how do somebody, a younger person who has engaged with the company for anything,
Yeah.
how do they maintain their independence
Same.
without
I
being
mean,
influenced by the company? That
yeah,
is
I
my
tell you.
question.
Their independence, okay, it is called a red line. You create the red line on the first day. And that line is that look, I will only support scientific products. This is what is the thing. And if there is an evidence, you show me, okay, or give me the evidence to study, I will definitely prescribe this product. You don't have to do anything else. You understand my point, no? This
I
message,
understand.
this message should be going very clearly from the doctor's end. And pharma, I believe, is that the representatives met who are way less educated than the doctors. Okay. So they would not be, I have my experience in the field does not show that they are audacious or they are misbehaving. They will follow a doctor as a doctor, right? So it is the onus of the doctor who is in a socially superior position to send this message. Look, I will show me the evidence. I, if you can prove me that this evidence works, okay, I am okay to prescribe it. And then he should prescribe. He should not immediately enter into a competition that this person is this product and that company has the same product. Therefore, let us have a bid and then whoever pays me more, that I do. Okay, that
So
system.
basically, ethics and morality is at the base of
Yeah,
it.
yes,
And
yes,
nobody can teach that. Everybody has their own parameters.
yeah.
So, sir, we are coming to the end of our podcast. I have
Thank you very much.
one last question for you.
Yeah, yeah,
You know, that we have discussed for roughly 55 minutes.
yeah.
So I would ask you if you had one message for us gynecologists who are practicing, about the future of women's health and the role of pharma in that, what would that be? I would like this message before we end the session.
Yeah. So, ma'am, the the you need a one-line message, right?
Yes, sir.
Yeah. So, pharma should be seen as a knowledge and innovation partner, but the doctors must keep their clinical independence and credibility non-negotiable. So, it is a bilateral role. Pharma need to engage, and the doctors will have to make sure that knowledge and the innovation, clinical independence and the credibility is the central theme of his future, not only just the present.
So basically, sir, what you're saying is both sides maintain their integrity,
Yeah,
morality, and ethics. And
yes,
if that happens, then everything runs smooth. And we as an industry, as
yeah,
two partners to giving care to the women of India, would
definitely.
really be able to do a better job.
Certainly. I totally agree with your statement. The future of women's health will be defined by prevention, personalization, and partnership.
Thank you, sir. Thank you so much. And I hope you don't forget us after this podcast.
No,
And there
certainly
are
not.
45,000 gynecologists who are ready to partner with you on research. So
Certainly.
if there is some project you let me know, and we would really love to contribute to accelerate the whole process.
Yeah, thank
So
you, ma'am.
thank you
Thank you,
so
ma'am.
much, sir.
Thank you,
Thank you,
ma'am.
Dr.
Thank you.
Jena. My
Thank
pleasure having you here. Thank you, Sunita ma'am, for this opportunity. Thank you, support team, for being with us always. Thank you. And
Thanks a
thank
lot,
you,
ma'am.
dear
Thanks, Fogsi.
audience,
Yeah.
for giving us so much love day after day. Thank you.
Thank you, ma'am. On behalf of Farmed, okay, I definitely am grateful that Foxy has given us this opportunity, and we look forward to work in future in tandem and in collaboration. Thank you so much.